At different referral hospitals in Kigali city, you find different people that were discharged but failed to find ways to get back to their families due to a ban on travel connecting Kigali and other districts due to the COVID-19 pandemic. At Ndera Neuropsychiatric Hospital, before these new regulations, between 300 and 350 patients received treatment daily, but now it is between 100 and 150 patients, a problem that is not only evident here, but also other hospitals. I came on a motor and it left me in Nyabugogo, then I figured out the rest of my journey to here. The challenge is the daily cost in transport. I used 5,000 Rwandan francs per trip. We woke up early in the morning around 4 a.m. We climbed a hill. We reached somewhere called Rushachi. We reached somewhere and got tired and sat down till a good Samaritan came to our rescue and asked us what the matter was. As people who were discharged, we request that they find us ways on how we can get back to our families. It's been 2 weeks now since we came in an ambulance escorting my parent to give birth here. We request that you advocate for us. They find us ambulances to return us to our homes. The director of the University Teaching Hospital of Kigali, Dr. Theobald Hategekimana, says that they have had discussions with the Ministry of Health to help patients who came in ambulances, and in case the number is large, a list should be made and sent to the Ministry of Health. This comes after Shimimana Michelle, an administrator at Ndera Hospital, says that the number of patients coming to the hospital for treatment reduced, posing a great threat to patients whereby they might become more ill. We make lists of patients taking the same route as we were instructed by the Ministry of Health. To those who figured their way here, they will still have to figure their way back. If we prescribe the medication, one has to figure out how to reach here and back. We are only considering only those that came in ambulances. There are patients that are finding it hard to reach here for treatment as before. We used to receive between 250 and 300 patients, but now they reduced. Those that failed to make it here are now up to 150 every day, whereby some of these will fail to recover from their illnesses. And Public Health Services Department at the Ministry of Health explains that the issue is still being addressed. As the Ministry of Health, we use vehicles that transport patients transferred to Kigali or for other duties to ensure that they transport those that were discharged as well back to their respective districts. The other thing is working hand in hand with referral hospitals to give us lists of those that were discharged, which we forward to the district hospitals to consider taking them back to their homes. To those with prescribed medication, again using these vehicles, we ensure that they transport that patient to the medication receiving point and again transport him or her back. Not forgetting that the Ministry of Health also empowered district and other referral hospitals with health experts. In Kigali city, hospitals that receive patients sent by the district hospitals include the University Teaching Hospital of Kigali, Kanombe Military Hospital and Ndera Neuropsychiatric Hospital. Innocent Mugabo, RTV News.